Okay, so for those of you joining newly, my name is Stephen. I'm a Global Challenge Research Fellow based at the Department of Computer Science. I'm very happy again to see you all here and also to welcome new participants to the final session of our three kind of sessions, Brunel African Research Seminar Series 2020. So the seminar is organized in collaboration with the Department of Computer Science Research Development Office, RSDO, and the Global Challenge Program. So in today's sessions, we have 5 wonderful presenters. Yeah, so we have 5 presenters that are going to share their experience with us, including, of course, me as well. I'm also part of that 5 today. So the Brunel Seminar Series is really part of the effort to promote remarkable work that Brunel is actually doing in Africa. So over the past, Brunel has done an exceptional research work, but some of this research have been buried within the institutions and also within colleges. So this research seminar really tried to kind of unearth that and also start the discussions around future collaborations and partnership. I believe it is also very important for us as we participate to start thinking about building new relationships and also partnerships. And if you have any questions regarding that, you can also send me an email. Like in the previous sessions, I believe our gathering here today will also provide opportunity to foster some form of what we call new research. So we expect the seminars to follow by an inaugural, what we call the African Research Conference coming up 2021. We're looking forward to that. And also the subsequent development of Brunel African Research Academy. We're still struggling with the name, what sort of name we're gonna provide with that. So the main purpose of the academic or network, would be to foster future partnership building, develop new research agenda, and maximize the output of Brunel research in Africa. This net academy or network also fall within the Brunel African Regional Working Group agenda, which is currently in progress. So we also expect to organize other activities following this conference that include hosting project grant application writing sessions, and also capacity building, particularly for early career researchers, both at Brunel as well as in Africa. Details of this will be communicated to everyone here. So without wasting much time, I think we have to start with the presentation. More information will come as we proceed. So without wasting much time, like I said, let's start with our first presenter here today is Dr. Derek, who is going to present on modeling and migration.
Okay, very good. So good afternoon, everybody. My name is Dirk Groen, and I'm a senior lecturer in the computer science department. And I work in a range of different projects, but the central theme is essentially to model human migration, and not necessarily economic migration, but forced human migration. So people who escape conflicts or other adversities and trying to seek safety. What we essentially did is we developed an agent-based model that tries to mimic the movements of people escaping violence and seeking safety. The project started off with me and my PhD student at the time, Diana Suleimanova, developing a prototype code back in 2016, but has evolved since. And these days, there are actually three EU projects involved in trying to build better models, as well as a whole range of institutions. The names I put on this slide are mainly from my local research group. So Ali Reza, Diana, Imran, and Hamid all contributed. Gebra Mariam worked as a postdoc for a few months as well. And then there are some people from ECMWF whose content I present as well today, since we also take into account some weather components. Now, the main reason why we want to model the movements of people that escape conflicts and try to seek safety abroad is threefold. The whole process sort of started in 2015 because there was a lot of war in Syria, and refugees were on the front line of the newspapers in Europe, at least. And what was a little bit surprising for me at the time was that the authorities had no idea that all these people were going to arrive, and seemed completely ill prepared to actually facilitate them and give them good circumstances. And at that time, I thought, well, perhaps a modeling code can help and actually help NGOs and other authorities to prepare for people arriving and make sure that supplies and shelter are in place when they arrive, rather than scrambling to arrange everything after they have arrived. So the main purpose of modeling forced migration is to try and save lives, and to help governments and NGOs to correctly allocate their humanitarian resources to the different camps, make sure that the right amount of support is in the right place. There are also two other motivations that emerged as we were doing the project. The first one is that we found out that the data collection is very often incomplete, and when people make estimates of the number of people being displaced, it's very much not correct, because in some areas they simply can't register the people or measure how many people have been displaced there. The simulation code can also help complete such incomplete data collections and make better estimates on how many people have been displaced in given periods. The third reason is sort of a societal reason, or a public reason, and that is that a lot of countries have very often quite strong policies when it comes to receiving and accepting refugees and other migrants. It's quite common for countries to close their borders when an adjacent country is at war, and other countries put all sorts of restrictions into the way that people can come in. In some countries, all the refugees are gathered and placed in one camp, when others, they may be redirected from some places, but they're actually all across the country. What we can do with the code is investigate these different scenarios and see, like, okay, what are the consequences for other countries if one country decides to close its borders, for instance. To develop the simulation, we use a simulation development approach, as the phrase implies. And it's very important that we look beyond the model that just computes the thing, because every time a conflict erupts, we have to construct the whole simulation. We have to choose what country and time period we have. We need to figure out, okay, what data sources are available, and the one we always have to rely on is geospatial information. Where are the key locations, the camps, the conflict zones, the other towns and settlements? How are they connected? How do the roads go? And ideally, we also have a little bit of historical data so that we can validate our model against the historical situation before we start forecasting into the future. We also rely on conflict data from the Armed Conflict Locations and Events database if we validate a historical conflict, but if we predict, then we actually try to use a conflict generator or conflict model to figure out, okay, how could conflicts evolve in time? Using those data sources, we construct a model, which is camps, conflict zones, routes connecting them, and of course, the people moving from place to place. And then we refine the models with population data and the various interventions that have taken place by different authorities. We then run the simulation, validate it if it's a historical simulation, or analyze the results or its behavior under different assumptions if we make a forecast. And the whole approach is explained in a scientific reports paper from 2017, which I mentioned at the bottom. I don't have the time in this 10-minute talk to explain the whole FLEE rule set, but on the right you can see an example of a location graph where the conflict zones are in red, the intermediate location yellow, and the camps in dark green. And essentially, each agent represents a potential refugee. And on a given day, that agent decides, do I stay put in one place or do I move to an adjacent location? The probability of that depends on the level of perceived security. So the more secure the location, the lower the probability. So for refugee camps, it's 1 in 1,000. For conflict areas, it's 1. And then if they do choose to move, where do they go to? There are a number of factors that play a role there, but the main one is distance, as well as level of safety, and also they will not move towards camps that are already at capacity. The agents are not smart, humans are smart, so the code is not realistic in terms of reproducing the behavior, but it is reasonably good in reproducing the outcomes. So far, we've constructed 6 simulations, 1 in Mali, 1 in the Central African Republic, and then 2 simulations each for South Sudan and Burundi for different time periods and different conflicts. With the exception of the Burundi 2019 simulation, which is still in progress, we have been able to predict at least 75% of the arrivals correctly when we compare it to registration data from the UNHCR in the various camps around the countries. And as of yesterday, we've also been asked to create a simulation of Ethiopia. So I guess that's another one that we will be adding quite soon. Just to zoom in specifically on one interesting sub-project. So as part of the Hidalgo EU-funded project, we're developing a coupled model for the South Sudan conflict, where we combine 5 different components. So we have a migration model, which I just explained, which is called FLEE, for the whole country. But then we also made a more detailed model for the 3 provinces in the east of South Sudan, because there are a variety of circumstances that make movement very different in that area. First of all, there are not many roads there, so people tend to use walking routes a lot and even cross rivers. Then we have 3 supplementary models that we also integrate with this application. A very important one is the precipitation data from the ECMWF, because the Blue Nile basically goes through that part of South Sudan, and it really affects road accessibility near the river, but also the river itself can become tens of kilometers wide, making it practically impossible to cross it. We also have integrations with conflict models. When we forecast, we can't take conflicts from a database. We have to try and figure out, okay, how could a conflict realistically develop, and create many instances of that. And we also have an integration with food security data, because some migration may be triggered by starvation rather than through violence. So we also want to be able to account for that. Here's a very simple example of what it looks like when you forecast a conflict rather than having a known conflict progression. So if you have a known conflict progression, you just have one simulation, you take the data from a database, and then you generate the number of people that will arrive in a camp. So you can see an example of that on the right-hand side, with the days elapsed on the x-axis and the number of people in the camp on the y-axis. Now, if the conflict progression is unknown, we use the flare code to generate different possible conflicts. None of them are correct, but hopefully all of them are at least remotely realistic. And then those, say, 100 simulations feed into 100 FLEE simulations. And then we create an uncertainty range around the outputs of the FLEE simulation. And that's what you can see in the graph to the right, where the red line is the average number of people that we see arrive in that particular camp. But the blue region shows the number of refugees that we expect within 95% of the simulations that we have run. This too we've published in the paper where you can read more about that. Now, as I mentioned, the White Nile is quite a major component in the east of South Sudan, and that's why even the micro-scale model that we developed itself is not good enough, and we actually need to incorporate weather data and weather forecast directly. This river is 750 kilometers from top to bottom in the east of South Sudan, and the width goes from about 5 to 6 kilometers, but it can be 20 kilometers or more. And you can see on the right basically how wide it is, because one pixel on that image is basically 500 meters, and you can see how much wider the river becomes when flooding is occurring. To do the weather coupling, we made a first prototype, which hasn't made much difference to the results yet, but we're working on expanding it. So we have data from the ECMWF on river discharge at the town of Malakal. And essentially what we do is we close a link in the simulation when that exceeds 8,000 square meters per second. That didn't affect the accuracy much yet in a good or in a bad way, but we're planning to expand this implementation and include more weather effects to try and make our code more realistic. And this data is provided through the Copernicus project, which is great because it means that it's public and we can also use it in other projects and with other countries. Just to show you a little bit what the coupled model looks like, on the left side you see the location graph for the whole South Sudan model, so the macro scale model, and then that is coupled to the micro scale model, which you can see on the right hand side. The 4 places that have a circle around them are coupling locations, so agents travel between the 2 models there. And the numbers on the links are the distance of the links in kilometers, and we actually use route planners for that. So it's not straight line distance, but actually using the OpenStreetMap route planner. Lastly, I just wanted to show a little bit of a result, so I just added this to my slide set. It just shows the average relative difference compared to the measured data, both for the uncoupled simulation, which is the green line, and for the coupled simulation, 2 versions, one with weather and one without. As you can see, The coupled simulation works a little bit better in the later days, slightly worse in the earlier days. On average, it's slightly better, but there's still a lot of refinement and development that we need to do. So that is very much a work in progress. And with that being said, that's basically what I wanted to show today. I mainly focused on the approach itself and not so much on how we apply it around it. But I hope this was useful. And if you're interested in using the code or in us helping out on any aspect, let us know, because everything is open source. Thanks a lot.
Okay, thank you so much, Derry. There's one question, but that one you can hop on the chat box to respond, because we're moving to the next presenter.
Thank you very much, Stephen, and good afternoon to everybody. And thanks for making time out to listen to us. So my presentation today will be on the COVID situation in Ghana. And by way of introduction, my name is Nana Anoche. I'm the director of the Division of Public Health at Global Public Health at Brunel, and I'm the convener of the Brunel Global Health Academy. I need to place on record that the work I'm coming to talk about today, it's one of the babies of the Academy, and it's a collaborative or a teamwork between Brunel Global Public Health Academy and the Ghana Health Service in Ghana, Ghana Health Service, as well as other team players with a hospital in Ghana, which is the main treatment center. Okay, so in the next 10 minutes, I will walk you through, I'll briefly tell you about the Global Health Academy here at Brunel, and give you an insight with respect to the state of COVID in Ghana, the impact of the policy responses, and a feel of the risk factors of COVID-19, particularly with respect to mortality, as well as the length of time spent at the hospital. So the graph you see here gives you a clear indication as to the regional distribution of COVID active cases in Ghana. And we've demarcated this into the COVID cases, active cases, from March to November 2020. And the figure 8 tells you about the cumulative COVID cases for the same time period. I wouldn't want to bore you so much with the details. So moving on, Brunel Global Health Academy, it's an academy made up of researchers and policymakers all around the globe. And the picture you see here, it's a snapshot of a stakeholder engagement that we undertook in Ghana. That was way back in February this year. And that was to build consensus around how obesity could be addressed in Ghana. So with this workshop, the people you could see here as policymakers in Ghana, and we interacted with them to come out with what are the interesting questions that they would like to have answers to. Now, our main goal as an academy is to promote capacity building in health research, particularly in low and middle income countries. At the moment, we have well over 10 doctoral researchers, and I'd like to acknowledge the unique contribution of one of our doctoral researchers, Ms. Shirley Cranston, who is probably part of the audience today, because the work we're going to talk about here, she's the leading contributor of this work. And then in terms of our global partners, we have global partners dotted around the world in Brazil, South Africa, Nigeria, and so many other countries. For this particular work, special mention needs to go to the Ghanese Medical Health Center in Accra, as well as the Ghana Health Service. So, COVID in Ghana, when did it all start? It started a bit late. So the first cases of COVID in Ghana were recorded in March. So that was exactly 12th of March. That was when we had the first cases recorded. And as of about a couple of days ago, Ghana, in terms of cases, we've had 51,000 confirmed cases. And out of them, we've had over 50,000 recoveries. And unfortunately, about 323 deaths have been recorded so far. Now, in a bid to address this pandemic, Ghana developed 5 key strategic objectives. And the first one was to limit and stop the importation of the virus. Because I think the main principle behind this was that the virus did not originate from Ghana, and therefore we're able to shut our borders and stop people with the virus coming in, then so to speak, that would be a way to contain the local transmission. And the second approach was also to contain and slow the nationwide spread. And on top of that, to provide adequate care for patients who might get infected with the virus. And then the government also intended to expand, use this opportunity to, they wanted to use this as an opportunity to expand domestic capability, because during the lockdown, I think one of the harsh realities Ghana got to face, was faced with, is the fact that when it comes to sanitizers and nose masks, the harsh reality was that most of these things needed to be brought from abroad. So the government then thought that this is high time for us to then expand our local capabilities to set up industries to provide these facilities or these equipment. Now, for policy responses. So the first one started in March 20, to the 22nd of March, and that was the closure of entry borders. And interesting, I was among one of the first people to that this quarantine or this process started with. So to tell you a bit of a story, we got to the airport, we didn't know anything about it, and we were just ushered into a vehicle with police escort and military escort, sent into a hotel where we were quarantined for 2 weeks. During that time, a number of tests were taken. We had 2 tests, and those who came out negative from these 2 tests were let to go. Those who were positive were then sent to the various treatment centers. Around the same time, there was a partial lockdown of the 2 main cities in Ghana. And this policy was in response to the data. So the data coming out at that time showed that most of the cases, most of the COVID cases centered around these areas. And therefore, the government thought that once they shut or lock down these areas, they'll be able to control the virus. Now, during this, the main aim of this lockdown was, quite apart from controlling it, it was also to help the government enhance their contact tracing, testing and treating, as well as increase surveillance. In the next slide, I'm going to show whether this was effective or not. And the government has also since then established infectious disease centers. Before then, we didn't have infectious disease centers in Ghana, so the government has went on to establish a few of those. And to lessen the economic impact too, the government established the COVID alleviation program. And this was to help local industries, because during the lockdown, it obviously affected their sales and also affected the operation of these organizations. So this alleviation program was to help them as well. And there was also, or since then, there have been intensive nationwide education on precautionary protocols. So anytime you watch the national television, you hear educational programs going on to tell people about the protocols that they need to observe as a result of COVID. Okay. Now, what I want you to take home message from this very slide is that right from March up until somewhere July, the government, in terms of policy response, the government has come out with well over 20 policy responses. And the orange highlighted responses are those that relate specifically to health system. The green ones are for public health measures, and the blue are socioeconomic measures. Now, given the context of this presentation, I'll focus on the public health measures. So to date, the government has come out with 11 public health measures. And these measures covers lockdown, enforcing the protocols, as well as coming out with interventions that will increase intensive contact tracing, increase the care given to people who will be infected with the virus, and also make sure that those who are found to be infected, the contacts, i.e. those people who have come in contact with them, are quickly identified, and then if they are found to be positive, taken to the various hospitals. So the government strategy, well over 20 of them, 11 of them in terms of public health, have centered around these main bits of containing the virus. Now let's see whether these interventions have been effective or not. So this graph shows you the distribution of the COVID cases in Ghana. And this is by date of the sample taken from March to November 2020. These are during the lockdown, which the lockdown happens to be one of the key aspects of the government's intervention. the viral spread increased steadily during the lockdown. But after lockdown, it slowed marginally and started increasing again. So while we recorded our highest rate in June 2020, and since then, we've observed a marginal decrease. Okay, now the key interesting fact is, and I don't know whether we can allude this to the lockdown or not, is that post-lockdown, the spread or the rate has been way higher. Could we say that this is, I think one could argue that simply this is the nature of the disease, and because we started our lockdown much more earlier, that was way in March, that was when the disease has started and local transmission hadn't embedded very well. And that is why we are seeing this increase. One could argue that if that is the case, then why was the time of the lockdown the right time to lock down? Maybe the lockdown could have been much more later or even much more earlier. Now, the effects of the policy response, other effects, here we're talking about probably positive effects, is that our testing laboratories have increased from 3 to 10. And this has also led to the creation of 3 treatment and isolation centers. And I'm pleased to say that currently in Ghana, as you could see by the picture, PPEs are being produced. So gone are the days that Ghana needed to, import PPEs from abroad. Currently, all PPEs being used in the nation are produced and supplied within the nation. And the government has also employed local businesses to do that. Over 1,000 health workers have also been trained as frontline workers, and there have been a number of incentive packages, including tax waivers and insurance packages given to the health workers. Now, the fact that Shelley is a health worker, I think somewhere along the questioning time, Shelley might be able to share a bit more light on how effective some of these policies have been. So, going to the research itself. Currently in Ghana, we have the Ghana East Municipal Hospital, and that happens to be the main treatment center when it comes to COVID in Ghana. It was established in March 2020, and it's a 100-bed capacity hospital with ultra-modern facilities. In terms of staff, they have staff numbering well over 800 covering different specialties. So we have physiotherapists, people specializing in internal medicine, pharmacists, and radiologists. The data set I'm going to present here is a unique and novel data set in the sense that this is a data set coming right from the source, the main treatment center in Ghana. So the data set collected by the Ghana East Municipal Hospital. It's because of the nature of the disease, because the pandemic is still ongoing, this is an ongoing data collection. And by the time this analysis was done, I think the data was well over 400. So what does it tell us? So based on our analysis, we found that the distribution of COVID infection, focusing on that hospital, the probability with gender, we have the infection rates higher. So we have about 55% of the people with the virus at the hospital being males. In terms of nationality, we have many of them being Ghanaians. That's probably not surprising. And for education, we have secondary, those with higher education, i.e. secondary and above, being the most likely to be infected. And employment status, we have those who are employed. We have those having the disease, we have well over 72% of them being employed. Marital status, 48% of those who have COVID were found to be married. And in terms of comorbidities, majority of them had hypertension. And this was followed by those with hypertension and diabetes. So you could see clearly that hypertension seems to be quite a risk factor. But when we move on to the multivariate analysis, let's see whether by controlling for other factors, hypertension also comes out to be a risk factor. In socioeconomic status, this graph is quite interesting in the sense that the popular message across Ghana is that this is a disease for the rich. I don't know where that came from, but that seems to be the local observation or the observation that people tend to make. But when we did the analysis, we realized that 50% of those with the virus happen to be from the middle class. And the high class happen to be just about 23%. Whereas the low class happen to be those in the in the lower class happen to be about 26%. An interesting part of this, we need to kind of look at this with a bit more caution, Is it because those in the high class, when they get the virus, tended not to report at the treatment centers because they had the facilities to take care or self-isolate in their homes? That could be an interesting discussion point. But given the analysis, it appears that this is not a high-class virus as being propagated in the country. Now, so following that, we did multivariate analysis, that was when we controlled for all other factors to really find out what are the key determinants of mortality or hospital admissions. And our findings show that age in particular seems to be highly associated with critical symptoms. So with an increase in age, is associated with 6% increase in a person having critical symptoms of COVID. Now with males, we found that males were 85% more likely to die from the virus compared with females. And the hypertension was, compared to the critical illnesses like cancers, was found to be negatively associated with the critical symptoms of the virus. And socioeconomic status here, talking about those in the high class, were found to be a negative predictor of the length of time a person will stay at the hospital. Now, when you strip out all these other covariates and we just focus on bivariate analysis, looking at the crosstabs, we found that age, comorbidities, and level of education were significant positive predictors of mortality, and nationality and socioeconomic status were also found to be positively associated with hospital admissions. So in conclusion, I think what this clearly shows is that comorbidities, probably not surprisingly, is a key risk factor. Now, but the key point here is that could this be associated, have we established the causality? And I'm not sure this to date, the causality has been established. It's an association. Could it be that people die from the comorbidities or they get a virus and it's the COVID that leads to their death? I think this is something that needs to be looked at more closely in research. And also at this stage, there have been a number of policy responses all around the world, in Ghana and other places. But today there seems to be paucity of evidence around evaluating this policy response. And this is quite key, because when we've understood what the patterns of this disease is, the key important factor is to know what are the key interventions and how effective are they before we can move on then to assess the value for money of those interventions. And although I've heard that the vaccine is coming out, by knowing which policies are workable, I think it could prepare us for another unwanted eventuality. Now, what we also found during this analysis is that there is a need for more comprehensive data collection. I know in the UK we had a visit data, but even with that, collaborators working on that shows that because the pandemic is new, there is a need for more comprehensive data to help us understand the dynamics of the infection. Now, finally, I'd like to leave you with this. And this is a quote from the president of Ghana. Now, we know how to bring the economy back to life, but what we don't know is how to bring people back to life. So this calls for, increased research around understanding the dynamics of this virus. And I know the science world has really done very well with news coming out of the virus. I think we still need more. We still need more to understand the dynamics of infectious diseases, which policies could help address them, and also the cost effectiveness of those policies. So that's me done. Thank you very much.
Thank you so much, Nana. Okay, we moved on to Hannah, development on the margins.
Okay, so hopefully you're seeing my PowerPoint slides. I'm actually presenting something slightly different to what was advertised on the initial slide, which is a project on Wabera Street, history, memory and belonging in Kenya. And this project kind of emerges from the recent global movement to remove memorials to public figures with links to slavery and colonialism, which has kind of laid bare some of the problems of preserving and displaying so-called national heritage through monuments and other acts of commemoration. So while these are often kind of promoted as inclusive nation building exercises, they can also be perceived as a source of oppression, particularly by marginalized groups. So I'm in the process of examining these issues in relation to the Kenyan state's memorialization to Daudi Dabaso Wabera, who gives his name to a central street in downtown Nairobi, which you can see in this picture. Wabera was the first African colonial district commissioner posted to the Northern Frontier District of Kenya, and we can see the location of the NFD here on this map, where he was assassinated very shortly after his posting by Somali separatists who were at the time fighting for the inclusion of this part of Kenya to become part of a greater Somali state. And Wabera Street is one of a number of commemorative street names that celebrate nationalist heroes from the independence era, from the 1960s. So I've highlighted some of these. Here we can see Robert Ngala Street, after Robert Ngala, a Kenyan independence era politician. We have Mama Ngina Street, after the first Lady of Kenya. And of course, there's also Kenyatta Avenue, after Kenya's first president. And there are many more on this map that I could point to. Now, unlike many of these Kenyan nationalist heroes of the 1960s, Wabera is actually mostly unknown in Kenya, except for in the NFD, where he was born and where he died. So Wabera's inclusion within the kind of glitterati of Kenyan nationalist heroes is a little intriguing, given his relative anonymity. And what I'm kind of interested in, or what I propose in this project, is that his memorialization was part of an attempt by the Kenyan state to discipline his memory and that of the separatist conflict within the Kenyan national narrative, and to kind of obscure the meanings of his death in other competing nationalist narratives. So the central question kind of behind this research is, what is the history and politics behind Wabera's commemoration, and what do conflicting narratives about his death and its memorialization tell us about competing ideas of citizenship, belonging and nationhood in Kenya today? The project is based on archival and oral data. So oral histories that I've been collecting in Nairobi and parts of northern Kenya now since about 2008. And in particular, I make use of life history interviews with northerners living across what was the NFD. The research draws upon some insights from political geography and the critical approach to toponymy. In particular, that ordinary settings like street names, these can operate as political settings, and therefore we can use them as a way to examine issues of history and memory. Second, that commemorative street names are part of a process of celebrating, reifying and naturalizing an authorized version of history. And third, that while the authorities might decide who is to be commemorated and where, they can't control the responses to the past that are evoked by those commemorations. So, whatever the intentions of political elites through street naming, street names can also become focal points for dissent and opposition. So to go to Wabera Street, there are three main narratives surrounding Wabera and what his memorialization represents. First is the kind of official or authorized account. So Wabera Street was named in 1964. This was part of the process of decolonization in Kenya, and this involved the removal of prominent colonial symbols from the urban landscape. So actually, Wabera Street was previously named Elliott Street, after the third colonial governor of Kenya. And you can see Elliott Street in this map and in an image from 1951. So Wabera Street was named as part of a process of Africanizing and nationalizing the Nairobi cityscape. He was included as the first African district commissioner and as a martyr who died fighting for Kenyan unity. And Wabera's appointment as district commissioner in the NFD by the British in the run-up to Kenyan independence was a very political move. Wabera was from the north and he was a Muslim. And it was therefore felt that he would have some sway over debates about the future status of the NFD area, you know, where the main support for separatism was among Muslim, Baran and Somali communities. And some local accounts of Wabera's time in office do suggest that he was gaining traction. He was able to influence this debate about the NFD. For example, you know, this is the kind of memory that the Kenyan state wants us to take. You know, a recent article refers to the district commissioner who paid the ultimate price for Kenya's unity. But while Wabera is memorialized by the state as a national hero and a martyr, the second meaning inscribed into this memorialization is that he is a forgotten martyr. And this narrative emerges particularly among Baran communities that live in Marsabit, the town and region where Wabera was born. And in this case, Wabera's martyrdom, combined with his relative anonymity, is seen to kind of encapsulate the position of the Marsabit Baran community within Kenya as a whole. So like Wabera, who was, you know, a Baran for Marsabit, the Marsabit Baran were actually vocal opponents of separatism. They remained loyal, so to speak, to the Kenyan government during the separatist conflict. Yet, since independence and during the conflict itself, Marsabit suffered political and economic marginalization. So many Marsabit-based Baran therefore feel rather abandoned, betrayed, ignored, despite their sacrifices during the 1960s. So for many Marsabit Baran, the street sign bearing Wabera's name is a reflection, it's a superficial gesture of inclusion that obscures genuine political grievances that have repeatedly been ignored by both the colonial and post-colonial state. And the third meaning inscribed into this memorialization to Wabera is that it is a reminder of historical injustices. So in some popular accounts of the events of the secessionist conflict, particularly among those who supported separatism, Wabera's death is understood not to have been a simple political assassination, but actually was the result of a conspiracy involving British colonial officials. So some local people living within the NFD argue that the British colonial police officer at the time of Wabera's death gave over intelligence information to the separatist movement about the location and movements of Wabera, supplied the gun that was used during the ambush, and used his powers to ensure a clear escape for the getaway car. Now, it's highly improbable that this British official was involved in the assassination. But this version of events reflects a belief among the supporters of separatism that they had the approval of the outgoing British colonial power. And it is the case that there was support for Somali separatism within some British official circles. So on this slide, we have some extracts from official British correspondence on the NFD question. The problem was, as Kenyan independence approached, the British backtracked on their support for the Somali case in favour of a united Kenya. And so the connections that are made between the British official and the assassination of this pro-Kenya Wabera reinforces a sense and a belief among many Somali and pro-Session Biran that the British betrayed them, leaving them effectively to suffer their fate in Kenya. And the memory of this historical injustice is then combined with the memory of other historical injustices suffered by pro-Session Northern Kenyans during and after the conflict, which includes state violence and systemic intimidation. So what do these competing narratives and understandings of Wabera's memorialization tell us about ideas of citizenship and belonging in Kenya today? Well, and to be short, first is that struggles over the meaning of acts of commemoration, like Wabera Street, are not just struggles that are taking place between the state and marginalized groups, but these are also struggles between different groups of marginalized people. Second, and whether we view him as a forgotten martyr or as a symbol of historical injustice, Wabera's commemoration has implications for contemporary debates going on now about the place of Northerners in Kenya. So despite the fact that Somali and Biran people have always formed part of Kenya's indigenous population, they are often viewed as being out of place. And this is in part because of the history of the movement for session. But it's also related to more general suspicions about Northerners who, since the collapse of the Somali state in the early 1990s, have become scapegoats for insecurity. As such, and despite these state attempts to discipline the history and memory of Wabera within the Kenyan national narrative, Wabera and this commemoration also exists as a symbol of ongoing marginalization and embodies a sense that Northern Kenyans are not quite Kenyan after all. Thank you.
Okay, so this is my presentation, optimizing the primary healthcare access through mobile phone, informal use of mobile phone. This study started 2012 when I was doing my PhD. As a young student coming up, I was very curious about the widespread optimism that was existing in literature at that time, that mobile phone has come to Africa and is transforming Africa. So I was much more kind of really interested looking into what I call the contextualized kind of affordance. That is how people are really using it in their own context. So the study is part of, my presentation is sort of, it's part of a broader study that I've been doing in Africa, and I'm still doing it. So today I'm only going to look specifically at the informal mobile phone health use. So since 2000, there has been really a widespread optimism, like I mentioned, about the potential of mobile phone. And one of the key areas that mobile phone is being kind of really praised is around the use of mobile phones in healthcare, what we often call mHealth. And there has been a lot of study being funded, projects being implemented, applications being developed to address a number of healthcare challenges, right? Like issues around communication of information, dissemination, adherence to treatment of prescription, then also to a large extent are looking at using these applications for disease surveillance and patient care, etc. But however, what I found specifically was that while these applications are great tools, most of them are just pilot-based and they are very small-scale projects. And some of them end up disappearing for a while. So without this technology, people end up using their own mobile phone to seek healthcare. So I was really critical, really interested in looking at that contextual aspect. How are they using it without all these fancy technologies or schemes that they've developed? So I went down into Sierra Leone, which I'll give you a map in a moment. here, the objective here, first of all, was to really understand how are people using it, particularly marginalized, people who are at the periphery of the society who get very little access to healthcare opportunities. Those who are still very far away from healthcare access, completely away from all these technologies, etc. Then also, how do we draw on those experiences that they have? How do we learn and draw on those experiences for us to be able to develop not only better policy, but also better technology interventions? Often what we've seen, a lot of applications have been developed without actually understanding the context. So I was really critical understanding how are these technology being used. Okay, so that was me actually. I engaged myself, of course, in selling the mobile phone technology itself, just for me to get in contact of the cultural, the dynamics around the mobile phone use. Then, why did I do this in Sierra Leone at that time? 2012, Sierra Leone, and up to now, it's one of the least developed countries, with significant challenges in healthcare. And one aspect that really captivated my attention was the idea that there's always this, each time I read anything in people, anywhere you see that Sierra Leone has the highest, not even one of the highest maternal and mobility death in Africa. So I was critically really interested in how do we, of course, how mothers and caregivers are using this technology in their own little context. And there are also a lot of infrastructural challenges in terms of availability of health infrastructures like hospitals, and also the human capacity aspect as well. To a large extent, we can see almost like 0.2% of doctor covering a population of over 1,000. And in the absence of all this, within all these challenges, in the context of these challenges, the country started practicing what they call the plural health system. This was something that started years ago, at the end of the conflict. Some of you might have learned about Sierra Leone civil conflict that lasted for 10 years. So this is a plural health system. When someone is sick, particularly in the community, they have all these different options in terms of how they can get access to health care. They can either go to the limited public health hospitals that are available, or the peripheral health units such as community health centers. We also have a set of local actors called the local community health workers. So they also provide some form of healthcare services. And then, of course, traditional birth attendants, women trained and buried in communities to help delivery. These are midwives. And a whole lot of all these other healthcare key actors. So I was really curious, how are people really interacting with them, particularly those in the rural and marginalized area of community? So what did I find? Quite an interesting, really contextualized finding here, which I want to really a little bit spend some time on here. One of them was searching and organizing healthcare. Like I mentioned, that we have really complex and multiplicity of healthcare providers. So the challenge often people, explained to me was, how do they find, where do they go, and what type of healthcare do they seek? And this also has to do with the distance, proximity to the particular healthcare providers. So what the mobile phone actually did is giving them that kind of flexibility, and also to be able to do some form of simultaneous search. So they're able to use mobile phone without actually moving from their communities. If someone is sick, they can easily call and also inquire issues, contact the provider, sometimes they seek advice in terms of what type of treatments they can do. Then also request, for example, advice on drug administration and treatment, etc. Okay, and then the mobile, to a large extent, also enable the patient and caregiver to able to kind of make decisions in a kind of an urgent way in terms of where to go and how to go without moving. And that was really, really huge help for them, particularly those who are living in extremely extreme local areas. The other important finding I found was the idea of lowering the barriers to access healthcare. There are quite a huge number. Certainly like all other, some African countries, there is significant challenges relating to vast distance and high traveling costs associated to public health centers if someone is sick you'd have to travel a long way. And sometimes that may even result to putting the sick person at risk or sometimes even death. There are also issues around high search costs if you want to search for healthcare providers. There are also long queues if you go to some of these health clinics, and of course of the service. Those are all kind of really challenges they experience. In this space, again, what the technology actually does for them, according to the participant, was that it enables them to, of course, reduce some of this barrier. There was an instance when a particular participant responded to me that sometimes they have to call first the health center to know whether they should come or not. And that was really huge and significant help for this rural population. The third finding was the timely and life-saving decision-making. This is something I found quite interesting when I was doing my study. One of the things I found was that health-seeking behavior has a lot to do with what are often called family-mediated collective decision-making. So if, for example, a particular patient is sick, so there has to be decisions being made within the family context before even identifying a particular healers to go to. The reason being that, one, it has to do with what we call the household power relations. Sometimes the male dominant head of the family, everybody look forward for him to make that particular decision. Right. Another factor also correlates to the economic aspects. Those who have the money are the one in power. So they have to make all those consultations for them to be able to take this particular person or the patient to any care treatment. The challenge, however, in that context is the time it takes for them to be able to make that decisions. Sometimes involve face-to-face kind of communication, or sometimes it requires a messenger type of person. They have to send somebody to go and deliver that message. But again, with the technology mediating that process, it makes it very easy, and it made it very easy for them to be able to sort of make those mediations easily. Then also there is another really interesting area I also found was what I call the family healthcare supports kind of scheme. Again, it has a lot to do with poverty. It has a lot to do with the lack of access to some of the opportunities some of us enjoy in the Western context, like social safety net and healthcare coverage. In Sierra Leone, the majority of the population are without this healthcare coverage. So as a result, they only rely on some of their family members who are able to provide that fund for them to, if in case of illness. Again, the challenge there is that some of these wealthy, or what they call perceived wealthy family members, live far away, sometimes in the urban areas, urban communities. So if somebody is sick, they have to send somebody, or they have to call that person to come over. So what the technology actually does in this space is enable what we call the family healthcare scheme arrangement. So you can arrange, for example, the person can call a pharmacist or one of these healthcare actors to kind of provide treatment, then get the payment later on. Okay, and the final one, the people who are very kind of really also objective in their discussion with me was the risk associated with this. In as much as the technology itself provides the opportunity for them to get access to some of these healthcare opportunities, they also mentioned a number of challenges associated with that risk. One of them they mentioned was that they said increase the mobile, of course, increase people's vulnerability to seek care from the wrong providers, right? For certain illness, especially during emergency, if someone is sick, just take the phone to call before they have to develop a number of consultations first before they can do that. And they also discuss, issues around seeking care from a random providers may not have appropriate knowledge of the illness, may also likely subject the patient to risk. And the third aspect they also mentioned was that patients are likely to face risk of receiving improper care because treatments are prescribed without the provider's adequate knowledge of the patient illness status. Then interesting one was they said, well, in cases where advice were sought, for example, from some of these local medical providers, was that the administration of the drug, especially herbal medicines that we are often conveyed over the phone, sometimes we are not clear, and there is a risk of them either taking an overdose of that medicine. Okay, so what happened after all this interesting finding? What are the implications of it? What do we really what does this study really mean in this context? So one of the really implication is that the study unveiled what we call the complexity embedded in the informal healthcare seeking behavior and practices, which has been mediated in mobile phone. So the mobile is able to kind of really mediate that particular process and to help inform some form of policy making. Okay, and then again, what the study discovered was the increase in the use of what I call the new frontier of reinforcing kind of strengthening family support scheme. I mean, for me, that is really one of the fascinating things I really found. I mean, even when I'm here in the UK, I do provide, of course, be part of that particular family support scheme in terms of providing some form of fund to help care other people. And there was also another one there, in as much as the mobile phone there are quite a significant number of challenges around the technology itself. One of them was digital literacy. This is something I've written a whole article on, right? Most of the technologies are they have the interface that is not in the language of, the language that the people actually speak, right? So sometimes there's quite a number of challenges around that. Then of course, the network quality, sometimes you will not get clear network coverage. Then also the financial burden, the technology itself levied on the people in terms of maintaining, that is buying credit and also paying for charging your phone. Okay, so there's also the need for a robust intervention to deal with the significant risks associated to the informal health-seeking behavior. Okay, so these are really some of the really critical implications that was discovered in this study. So what I did overall in the broader study context, I made some couple of recommendations here. One of them to develop what we call a broad-based citizen-centric telecommunication industry policy. At the time I was doing this study, since we started 2012 and up to now, there has not been any really strong telecommunication policies to look into all these challenges that the users experience. Then also the establishment of a strong infrastructure. That one has been a little bit improved, but still have a number of really structural challenges linked particularly to access to electricity and other, of course, poverty barriers. Then also, there are also issues around what we call awareness, knowledge about what the technology itself can do in terms of their own context. So yeah, so I also make recommendations around providing some form of skill set and in informal kind of institutions. More specifically, was that at the time I was doing this study, there was no sort of ICT body, right, that we actually look specifically into how this information communication technology can be deployed across some of the ministries. Okay, so what happens after this study? What has been going on since 2012? Yeah, so just on this small, the one about the informal mobile phone use, I was able to kind of really have 3 kind of book chapters from that particular study, 1 journal article and a conference paper as well. Then also in 2016, I made a recommendation for the establishment of one of these number 4, the 4th one, establishment of the telecommunication sort of ICT corporation. So luckily in 2018, when the new government came into power, he actually established, we now have a very strong agency called the Director of Science and Technology and Innovation. They're doing amazing work in terms of streamlining the ICT sectors and also connecting all the ministries. And they've also been really doing, developing innovative projects around human capital development, as well as in the health and incubation area. Okay, so follow on to that, I've also established collaboration between the STI, that is the Director of Science, Technology, Innovation with Brunel. Then I'm currently working on a very small ICT project looking specifically from the health provider perspective. How are they interacting with the patients and what are the challenges and who is paying for those services? Then my colleague, Anastasia and I are also currently supervising a final year student who is working with the STI to develop a low technology to help community health workers, particularly women, send reminders for antenatal visits. Outside the health sector, we've also started a new project trying to develop a new platform for African indigenous knowledge management. So this one looking at particularly in terms of how do we preserve African indigenous knowledge and able to share that. Then I've also established, we now have a research group, Computer Science for Social Good, which is specifically looking into using computer methodologies and techniques in addressing social challenges in the global south, then also doing some form of capacity building. Okay, so that is how far I've gone. Thank you. Yeah, okay, so in the absence of no question, then we move to the next presenter.
Yes, I just want to be able to know that everybody can hear me.
Yeah, loud and clear.
Right, so once again, I apologize, I'm unable to log in with the video because of some technical issues with my laptop. Now, my name is Clementina, and I'm currently doing my third year in my PhD research. And sorry, my research interest is in the politics of cultural tourism in Nigeria, examining production and consumption through the annual Calabar Festival. Now, for the sake of clarity, I would like to state that the annual Calabar Festival is a 30-day sociocultural event that features high on the country's tourism and development master plan. Although in recent times it's been cut down to 4 climatic days, but then it remains one of the most important cultural events in the country. Now, I have just returned from my data collection and only started doing the analysis of my work. So for this presentation, I'm going to run you through a brief overview of the study just to give you a background and then situate you to the context of the research. I'll also try to highlight the rationale of the study in the process and ultimately narrow the presentation down to the findings of a particular chapter of the thesis, which has to do with the production of cultural tourism. Right. So in contemporary times, it's clear that the expansion of cultural consumption continues to grow significantly across cultures within the globe. And cultural tourism has become, in the process, a global trend that has continued to increase in relevance as the relationship between tourism, culture, and economy have become inextricably intertwined in contemporary societies. As this sector continues to grow, many scholars, especially from the West, have conducted a lot of researches and published a lot of academic studies that exposes the implication and the importance of cultural tourism in modern societies as, first of all, not just a strategy towards enhancing economic growth, but of promoting local identities as well as marketing a positive image of countries to global communities. Now, these are prevalent in several academic works of influential authors like Robinson and Picard, Dean McCannell, Greg Richards, Cohen, and a lot of others in many of their series in this field. Now, I just narrowed the analysis of my study through the lens of festival because festivals these days have been widely alluded to as important aspects of cultural tourism and, of course, international system of economic exchange and a communicative expression of culture and identities. However, in my literature review and in the course of the research, I identified a gap in academic the academic field. Now, aside the notion that these studies have greatly neglected the African scene, they have been primarily focused on evaluated studies based on outcome, economic imperatives, and experiences rather than on process. So to fill this gap, my study aims to examine the processes and practices involved within the production and consumption of these sociocultural events, and more so from an African perspective. In the chapter dedicated to the analysis of culture and tourism production, I uncovered how human capital and material resources are combined to produce the festival as both a culturally and commercially profitable modern tourism space, and how the events of the festival construct the visions of the city as a cultural tourism destination. Now, to achieve that, I used interviews and participant observation methods to explore the motivations of those involved in these processes. And in the course, I developed an understanding of the value placed on culture and how such values are produced, circulated, and locally accepted within the city. I was also able to develop an understanding of how power and capital influence the production of culture tourism in terms of who has the power to produce the dominant set of values, the visions and sense of place, and for who these are produced and how they are produced effectively. I also considered certain key factors in this analysis, like the colonial and post-colonial experiences of the region under study, as well as its geographical context and the multi-ethnic nature of the city, and of course, most African societies. Now, in my findings so far, in conducting the field work, I observed that both the city and the festival are consciously produced as organized spaces for tourism encounter by city leaders and tourism stakeholders who I categorized as the cultural and civic networks of power and governance. Now, they do this by creating a dominant set of core cultural values and images reproduced in the festival performances and, of course, special arrangements. Now, many of my interviews with, sorry, many of my interviews with this class of people expose that among their practices, they try to create exotic imaginaries of more positive image of the city for tourism through romanticized space designs, costumes, security details, and all the performances. This was a practice that I visibly observed also. So aside the interviews and affirmations from the interviews, I was also on ground to observe this, and quite right. Now here, they also employ various representational practices that draw on a combination of modern, aesthetic, historic, rural, and heritage frames to kind of add cultural capital to their tourism potential and showcase their cultural heritage to the tourists. Now, one thing I also noticed is that in the production of these imaginaries of the exotic order, they employ certain approaches that include, I'm just going to run through, the use of esteemed brands within and without the city. So there are some brands that are known, that are respectable or respected in the Nigerian society. And so the producers try as much as possible to incorporate those brands into the production of culture, this festival for culture tourism offers. Now also the contracting and subcontracting of event management and tasks. They do this to ensure that if, for instance, there is a shortfall in the Central Planning Commission, that it does not affect the overall production process of the event. The branding of the festival space and the use of spaces of cultural symbolism were also high in the production of these festivals. Say, for instance, there are known resorts and leisure centers and natural heritage sites that are very, very much known in the city. And so these are subsequently branded to suit the needs and the interests of festival attendees. Now, I also noticed, I also found that the exoticism of cultural elements like dress, performances, dance, music, and so on were also high, and this they did to give a sense of the other, or perhaps to create difference. However, in the analysis that followed within the practices and processes of production, certain implications were drawn. And one of such is that tourists and the local community's perception of such idealized construction of place and event is developed subsequently with an understanding that they do not just passively have to consume, rather they actively use the emerging opportunities from these processes and practices to first of all learn, to renegotiate, and then contest their understandings of culture and sense of a place within it. And this is both on social and individual levels. Now, the analysis of all this reintroduced for me the contentions of authentic culture, which I subsequently summarized as the actual nature of everyday practical existence and understanding of identity, although this is analyzed in greater details within the analysis of my work. Now, a very important contribution of my thesis is the development of a theoretical framework that recognizes the transmobile nature of culture and an understanding of tourists as modern curators of culture. Although this is still something, a work in progress, I am still building upon it. But then the concept of transmobility, which I used, is a term I used to argue for how contemporary understandings of culture is influenced by understandings of the dynamic and transferable nature of culture, which has been made possible through the production and reproduction of specific sociocultural content across tourism destinations and their events. Now, in the framing of these concepts, the work of Baba, 1990, which his concept of cultural hybridity, which means the mixing of cultures between the West and East and with other cultures, was quite helpful in this framing. Now, this analysis so far was drawn from, or rather, I would say, influenced by my fieldwork experiences in observing the type of city imaging, the place design, the hybridization and mimicry of global cultural elements like dress, costumes, dance, music, and performances, which all together form the core elements of festival events and cultural tourism consumptions. This further points to the notion that modern production of cultural tourism is increasingly moving towards the satisfaction of tourist tastes. Therefore, even when the supposed authentic culture of a destination or a region is effectively produced and represented for tourist consumption, the underlying factor points to the fact that cultural preservation among the so-called conservative societies is targeted towards offering difference, which attracts tourists. So, in other words, tourists' needs and tastes invariably necessitate the preservation of distinctive or so-called distinctive local culture in order to create difference, which tourists seek. This goes ahead to highlight the overt and covert influence of tourists on the production of cultural tourism offers. Now, these were all arguments that were corroborated by many of my interviewees who suggested that even though the aim of the festival is centered around showcasing the authentic culture of the local people, the event is also commercialized to promote economic development, and in so doing, the production of events considers the popular taste of contemporary tourists from across the globe. Now, essentially, this chapter of my work considers how the festival is both a production of particular understandings of the city and as well as a producer of these understandings reflected through the practices and processes of cultural tourism. And its argument further centers around the fact that the processes of cultural production and consumption does not just extend above, but it intersects kind of broader national, regional, and local practices of socio-economic development and cultural renegotiation through tourism. And therefore, there should really be a systematic approach to the study of these processes, which is essential, especially within the African context. And that's it from me. Thank you.
Unfortunately, we've come to the end of this really 3 wonderful seminar. I mean, like I said, every good thing must come to an end. I personally would like to kind of thank everyone, all the presenters, the 17 presenters that we've had in these 3-day sessions, and also all the participants that have taken their really busy time to come and listen to us and also learn from some of the exceptional work that Brunel is doing on Africa. In particular, I would also like to thank my department, the Computer Science Department, for giving me this opportunity, and also the Research and Development Office, particularly our Honorable Thomas Ryan. Thomas Ryan, he's been really an amazing guy working with him to set up this seminar. He's always been on my tail. I bet you if you organize seminar with Thomas, you will know what I mean. Then also, of course, my colleagues from the Global Challenges Department, programs, they've been really, exceptional support. Jeff Rogers and Professor Simons, they've been our intellectual support corner. So like I said, this is not going to be the end of our African program at Brunel. We currently we're working on the African region, part of the African regional group. We're working on a number of initiatives linked directly to this seminar that we've had. So we're coming up with other upcoming events. We're planning our inaugural Son of African Research Conference coming up in 2021. Hopefully we'll have an in-person conference. Then also we're thinking of moving this presentation forward, not just stopping videos, but also having really a proper African academy or network that we did, for everyone whosoever interested in working on African research projects. Then also we're planning to have early career research capacity building. I'm really excited to have Clementina being part of this really research, PhD researcher that is excited to share her work in this seminar. So there are also a number of initiatives coming up. We'll keep you updated on this.